welcome to Fit and Well on IBrandTV. I am Michelle Abanum, and on the fitness segment today, we'll discuss how to tone your lower body. Of course, we are the Gym Fitness Factory, and very soon we'll be speaking to a fitness trainer. Do not go anywhere, because I'll be right back. Glad to have you back. If you're just joining us, this is Fit and Well on IBrandTV, and we are right now on the fitness segment of the show. We have on the show today, Nelo Perry, and she'll be taking us through how to tone your lower body. Hi, Nelo. Welcome.
Hi.
Welcome back on the show.
Thank you. Great to be back.
Yeah. Okay, so now let's delve right into the focus for the day, which is how to tone your lower body. Why is it important to tone your lower body?
Well, the lower body is the part of the body that carries the weight of most other parts of the body. It's on the floor. It's usually on the floor. It's the part of the body that we always use as a form of development, even for a child. So a child is born, you get to carry them around, then the child has to crawl, use of lower body, use of legs, right? Though the hands are also part of it. But then the child gets to walk, the use of the lower body again, all the way to having strong legs, to playing football, to running around. Even for an adult, when you want to have fun with your kids, they're going to run around, crawl under things. So it's really, really beautiful to be able to use your lower body. And the more you use it, the stronger you go into exercising it, the easier it is for you to do a lot of things, right? So it's a point that everybody definitely should, male or female.
Something tells me that the workouts, the drills for this particular kind of workout is going to be very tedious. Is that true?
Well, it depends. So for some people, their lower body is a lot stronger than the upper body. So for that person, anything you give them for lower body would be super easy to do. But for someone who prefers to work upper body, when you have to go to lower body, it's a big struggle. So it can be a challenge, I like to say the word challenge, right? But you know, if it doesn't change you, then it won't be challenging enough.
Right. So now let's delve right into the drills for this particular kind of workout. What kind of exercises do you have to do to turn your lower body?
All right. So for the lower body, right now we have multiple exercises, but a few of my favorites are the deadlifts. We have the step-through lunges. We have the jump squats. We have the what's it called now? We'd call it the leg raises, right? Leg raises. This also involves the core. And then to finish up with something as exciting as skipping, as simple as skipping, right? And then finishing up with sumo squats. So for lower body today, we are going to be working on a few of my favorite 6 exercises today. So we have the deadlift. The deadlift is more think, sit to stand.
Sounds dangerous.
Why? Because dead. No. So the deadlift is like a dead stop. You're most likely not moving from whatever position you set up for it. What you're thinking is bend to peak. So you hinge, pushing your hips back from your standing position, push your hips back, picking up your weight that's in between the center of your legs already, and you stand. So when you do that, you want to make sure your chest is not facing the floor, so your butt is not entirely up. You hinge, pushing your hip back to bend. By the time you hold on to the weights, you want to be able to see whatever is in front of you. So that will make you push your butt down. Then you pick up, pushing off from your feet. Deadlift.
Sounds easy.
Easy peasy. Okay, the second one we have step-through lunges. For the step-through lunges, you're going to be stepping through, like it says, right? So you're going to want to step forward and step back. That's all. But you want to position your legs in a way that your feet, especially the moving leg, is flat on the floor completely. It's only the one that is standing that is going to rotate through flat or bent, right? Because it's helping you move forward and back. So you're going to be working one side at a time. So you pick your right leg, for instance, and you step forward. When you step forward, your back leg is going to bend as well as your front leg. And when that happens, you want to make sure your knees is forming a straight line with your toes. Okay? Then you do the reverse of that and you step backwards like a reverse lunge. And you have both knees bent as well. And you also want your knees, this time the one in front, to be forming a straight line with your toes, right? Maybe not super straight, but your knees and your toes, right? That way you protect any injuries that you might have on your knees. So the third one is high knee taps. High knee taps. It's one of the very traditional ways to, get some cardio, especially when you're at home. You simply place both palms facing your knees, and you simply just hop off the floor, hop, 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 hop. So you just have your knees tapping your palm, right? So you can go as quickly as possible, depending on your level of exercise. Then the fourth one, we have the curtsy to front kicks. So you are going to be doing like a reverse lunge, but this time it's going to be a curtsy, like when a lady does a curtsy. So you're going to take that leg behind the other leg. So you just want your toes to be directly behind the other legs, nothing too extreme, because it also depends on your range of motion. Okay? So you want your right leg, say I'm going for my right leg first, you want your right leg going directly behind the foot on the other leg, so you have more action on the hip on the other side. Then you come back to standing position with your toes on the floor and you kick. Then return to that curtsy again, and then you bring it back. So you have step behind the other toe on the side, more action on the hip of the other side, return to the center, kick forward, and you continue that.
I love how you make workouts very easy. You make it look or seem easy until you get started. It seems easy.
Remember, it's only new, not impossible.
I like that.
Yes.
It's only new.
It's only new, not impossible. Okay?
Yeah.
Then the fifth exercise, we have the Sumo Squat. So for your Sumo Squat, you're just thinking wide stance. Sumo fighters, like our popular Hulk Hogan, right? Was it even Hulk Hogan? No, it wasn't Hulk Hogan, right? But there are these very popular wrestlers that are usually on the very heavyweight side. So they're usually very big. So for their stance, they take sumo, wide stance, right? Because you want to be well balanced on the floor, right? So you just have a wide stance, having your feet wide apart as comfortably as possible, not too wide and not too small as well, just to get a wide stance, something that's convenient for you to be able to increase your range of motion, especially when going into a squat position, which is sitting into the ground. And in this time, for the deadlift, your back doesn't have to be straight while sitting. There's a hinge, so you have a slant, an incline at your back. But for your squats, your sumo squat, you most likely be sitting with your back as straight as you possibly can. As straight as you possibly can. So you have your wide stance, your toes pointing out towards the sides in the same direction with your knees. And then you sit into the ground and you stand right up, squeezing your glutes as you stand. You want to stand fully, so your legs are completely squeezed once you stand, and return into that position, trying to keep your back as straight as possible. You could do this with weight or without weight, depending on your level of exercise. Then the final one, the glute bridge. This one, the glute bridge, is performed on the mats or on the floor, depending on what area you have. You would lie on your back, and you would place your legs, fold them up into a 45 degree, just placing them closer to you, right? Not too far from the body, not too close, just comfortable enough for you to be able to take off your butt from the ground. So what you're trying to use your core, squeeze your glutes to push off the ground. So your back is on the floor, your legs are on the floor, so your legs are your support to push your butt off the ground. That's what you're trying to do. So you squeeze at the top, return, tap, squeeze at the top, return, tap, glute bridge. Your glutes are your butt, you're forming a bridge. So you have a slight incline between your back and your knees every time you go up. There's an incline, go back, tap, incline, go back. That's all you're trying to do.
So how many reps should you do these exercises for a session?
Okay, so for the deadlifts, we want to be doing our deadlifts for as many as 8 to 12 reps, right? And then your step through lunges, you step forward and you step back. That's a rep, 1 rep. So you want to do about 5 to 8 per side, right? Forward and back, 1 rep. So you could do 5 to 8 reps per side. Then you switch to the other leg. For your high knee taps, you're tapping 1, 2, 3, 4. You could do about 10 to 15 or even 20, depending on how strong you are, but about 10. So 1, 2, 3, 4. So you should be able to do about 10, 15, or even 20 reps for your high knee taps. Then for your curtsy, 2 front kicks. You take 1 leg behind, you kick, that's 1 full rep. So you're doing per leg about 5 to 8 reps per side. Then you switch to the other side. For your sumo squats, we're going down and up. You should be able to go about 8 to 12 reps, or even more, depending on how strong you are. But 8 to 12 are like a basic number that you should be able to go for, also depending on the weight that you might add. Then we have the glute bridges. This is body weight, or you could also attach some weight to it. So you want to be able to go for at least 10 to 15 reps.
In general, how often should you do these exercises?
So to begin to see the results from these exercises, you want to have been able to repeat these exercises at least twice a week. The same set of exercises at least twice a week. And then you do it over a couple of months, at least 3 months. Sometimes you could see results a lot faster. So our body types are different. Some people might react a lot faster. Some people might take a little while because of metabolism and how our bodies are used to working. For some people, you might see results quick, then it slows down. So it just depends. But at least in 3 months, you get to see some amount of changes.
So the goal of this exercise is to tone your lower body. But there are cases where instead of toning your lower body, you begin to lose weight. Yeah, what could be the cause?
Okay, so right now, people tend to get confused. Toning will most likely lose an amount of fat when you want to tone, right? The body cannot take up like fat and muscle fighting for where they are going to stay. There has to be an amount of body fat and an amount of muscle as well to be able to give you the desired body that you want, right? So for you to be able to do that, you should be willing to lose some pounds, right? And then get it back through exercise, muscle building, and eating the right kind of food. So you're not just putting on extra fat, but you're allowing your body build more muscle, which would make you look toned like you want to, which is the goal, right? So do not be scared about losing some amount of fat. You will lose some amount of fat. Why? You cannot spot reduce. You cannot say, oh, I'm working only on my lower body, so as I'm walking and I'm jogging and I'm running, it's only my legs, but my hands will stay the way they are. No, it doesn't work that way. You would lose an amount of body fat, head to toe. Yeah. But because of your goal, you would now decide to do more work on your lower body or your upper body, depending on what your goals are, to get the results that you want.
Now, is it possible to do both your upper body and your lower body? I mean, your whole body?
Generally, you will definitely work the whole body, most likely. But some people tend to ignore some parts of their body because they feel they want to look a certain way. But to really enjoy the benefits of an exercise program is working the entire body, upper, lower, core, cardio, strength training, finding a balance between the entire thing to get the right results as against just the aesthetic results of how you look, but about how you really feel and how your body should be.
All right, thank you so much, Neto. It was really informative. Thanks a lot. Thanks for coming on the show.
Thank you for having me.
So guys, we've come to the end of the fitness segment. Now it's over to you, Perpetua. Let's see what you have on the wellness segment.
Ectopic pregnancy. Ectopic pregnancy is the leading cause of maternal mortality in the first trimester and accounts for 10 to 15% of all maternal deaths. Ectopic pregnancy is an important cause of maternal morbidity and mortality, especially in developing countries, where most patients present late with rupture and hemodynamic compromise. It is also a cause of fetal wastage and has been associated with recurrence and impairment of subsequent fertility. The true incidence of ectopic pregnancy is difficult to determine. It varies significantly among institutions and countries, depending on the metric used in its calculations and facilities available for diagnosis. Currently, the overall incidence is increasing worldwide, though with decreasing case fatality rate. The reported incidence of this life-threatening condition varies from 0.67% in Western countries to 0.9% to 4.38% in Nigeria. In a previous study in Southeast Nigeria, an incidence of 1.98% was reported. More than 95% of ectopic pregnancies occur in the fallopian tube, making it the commonest site. While treatment of ectopic pregnancy requires medication or surgery, success rate of surgery depends on experience of gynecologists, available medical equipment, and facilities.
Over 95% of ectopic pregnancies occur in the fallopian tubes. Other sites of ectopic pregnancy include the ovaries, cervix, cesarean section, scar, and abdominal cavity. The incidence of ectopic pregnancies in Nigeria is 1.5 to 2.5 out of 100 deliveries, and the condition is associated with significant mortality. Welcome to the Wellness Talk segment with me, Perpetua Fasamipita. We have Dr. Oyedare Elizabeth joining us via Zoom call. She'll shed more light on this topic. Hello, doctor. Good to have you on board.
Thank you, ma'am.
All right. The focus today is ectopic pregnancy. Help us understand what it is.
Well, ectopic pregnancy results when conceptors implant and matures outside the endometrial cavity.
How is it diagnosed? How is it diagnosed? How do we get to know someone has ectopic pregnancy?
Well, I would like to further say, just as you have said, anything outside the intrauterine cavity and in the endometrial cavity is ectopic. It could be abdominal, it could be in the fallopian tube, it could be in the ovaries, and so on. So the diagnosis could be made, one, by getting a serious serum beta HCG done. HCG, that's a human chorionic gonadotropin. You get a serial HCG done, then also with scan. If it's with the beta HCG, there is an appropriate amount of HCG that comes with gestational age. I don't know if you understand me. Then if it is scanned, there are some things you would see to understand if, peradventure, the gestational sac is implanted where it's supposed to be implanted.
And what are the telltale signs, or let's say the symptoms of an ectopic pregnancy?
Well, first it comes in with amenorrhea, that is lack of menses. Then I would like to say there's a triad for it, meaning there are three main signs that you can notice. It's either the three signs are present, or two or one is present out of the signs. The first one, amenorrhea, there could be abdominal pain, and there could be vaginal bleeding. Those triads. Once a woman comes in and presents with amenorrhea, an history of amenorrhea, that is, I've not menstruated for so days, my last menstrual period was so months. Then the person is complaining that the patient is complaining of abdominal pain, and as well bleeding per vagina, bleeding from the vaginal orifice. So, but aside those three signs, there are still some more signs like dizziness, like weakness. Some may even come with vomiting, with fainting, that's syncope. With fainting, some may come with okay, then there are signs you would see as a physician. There are some signs you see as a physician. You can see like abdominal rigidity. The person might come with shortness of breath, with tachycardia, with involuntary gagging, and severe abdominal tenderness, maybe on palpation. that is on palpation, rather.
Well, I want to believe that this particular ailment has risk factors and causes. Can you share this with us?
Thank you, ma. I think the commonest cause is tubal infection or tubal damage. And this could be as a result of pelvic inflammatory disease, that's PID. Also, salpingitis, that is an infection also of the tubes, of the fallopian tubes. Then also, if you smoke, it affects the ciliary movement of the fallopian tubes. So it tends to prevent, normally when implantation occurs at the fallopian tube, it's the ciliary movement that will ensure that the product of conception is moved to where it's supposed to be implanted, which is the uterine cavity. So once the smoking reduces the ciliary movement, so that one too can predispose to, it can be a risk factor to ectopic pregnancy. Also IUD, that's an intrauterine device. Yes, that one too can predispose to
ectopic pregnancy.
Ectopic pregnancy. Also, some hormonal contraceptives too can as well predispose to ectopic pregnancy.
I'm really concerned because when you were talking about the risk factors, you mentioned IUD, you talked about contraceptives. Are people really aware? Do they know that these are risk factors?
Well, from my own perspective, and from what I see from day to day, I would say people are not well informed. They are not well informed because starting with the way they present at the hospital, many times the pregnancy would have advanced before they present at the hospital, which means if peradventure it were to be an ectopic pregnancy, they wouldn't have presented early and it might be more fatal than necessary. And again, many times it's when the ectopic ruptures that they tend to present. That is when they are now having acute abdomen. That is when they now start rushing themselves to the hospital. So I don't think they are well informed. If people are well informed, they should know that once they miss their period, and they should rush to the hospital and get the necessary investigations done. If you have an early scan, like I said, that at least 38 days post the last menstrual period, one should be able to see the gestational sac in utero if it is there. So if you present early, it will help us to make a diagnosis early.
All right, so what you're saying now is that the best thing to do is to come in for checks once a woman notices she's pregnant, irrespective of whether the signs of ectopic pregnancy have set in or not. Am I on track? Is that what you're saying?
Yes, ma'am.
Okay. Now, how do we treat ectopic pregnancy?
I can group the management into three. The expectant management, that is watchful waiting. But the watchful waiting, one has to be very careful when you are doing a watchful waiting. It must be, you do a watchful waiting for a patient that is stable, a patient that is not bleeding. And the patient will be within the hospital premises. You monitor the HCG, the beta HCG I earlier mentioned, you monitor that so as to ensure that it's declining and the patient is not symptomatic. That is one. Then it will be managed medically. That is use of medication. They use a methotrexate. Then surgery too. And the surgery could be laparotomy or laparoscopy.
Now, this particular one is dear to me. Can babies survive ectopic pregnancy?
Wow. Well, this what I know is that the pregnancy itself can only survive for like 6 to 16 weeks. And we all know that the age of viability is 28 weeks and above. So definitely the baby cannot survive. But the reason why I said what I know about is because I think sometimes 2 months ago, I had of an history of somebody of a baby that survived abdominal pregnancy. Though the doctor in charge lost the mother, but I learned the baby survived abdominal pregnancy.
Okay, so are you saying that we can have safe mother and child outcomes?
99% will not survive it. 99% babies will not survive it.
All right, I remember while you were talking about the risk factors, you said somebody who has had it before, one of the risk factors is that for a person who has had it before, the person may have it again. Now, what precautions should be taken if someone has had it before? What precautions should be taken so that the person will not have it again? That's ectopic pregnancy. Yeah.
Okay, like I mentioned earlier, I mentioned some risk factors. Should ensure that all those risk factors are taken care of. We prevent pelvic inflammatory disease. We prevent sapingitis, which is infection of the fallopian tubes. Then presenting at, like I said, presenting at the hospital if you have a previous history of ectopic pregnancy. Presenting early will help us to, and I think sexually transmitted diseases as well, because those are the key infections that leads to PID.
Thank you so much, Doctor. But just before we end this conversation, is there anything you'd like to share?
As women, we should value our health and we should value our lives. We should always take appropriate and adequate care of ourselves. We should ensure that we are in sound health of body, mind, and soul at all times, because it goes a long way to help us. Thank you, Ma.
Thank you so much, Dr. Oyedare Elizabeth, for sharing your thoughts with us. Do enjoy the rest of the day.
Yes, Ma. Thank you so much, Ma. You too, Ma.
And it's a wrap on this segment. Thank you for joining. I am Perpetua Fasami Peter. It's back to you, Michelle.
Good job, Perpetua. I must say that was really informative. Now, guys, we've come to the end of the show. Till I come your way next time, this is Fit and Well on IBrandTV, and I am Michelle Abanom. Bye.